Hello, my name is Dr. Chandra Kumar. I'm an eye surgeon, and today I would like to talk about glaucoma. Now, glaucoma is actually a group of diseases which affect the nerve in the eye. Now, carrying the impulses from the eye itself to the brain, there's a nerve at the back which is called the optic nerve. And this optic nerve can be damaged in a disease called glaucoma. Unfortunately, it's not just a single disease, it's actually a subset or name for a group of diseases which have the same characteristics, which is damage to the optic nerve. Glaucoma, unfortunately, is a very common disorder. It affects 1 in 2,000 Malaysians, and the frequency actually increases with age, meaning that the older you are, the higher your risk of getting glaucoma. Now, glaucoma is one of the leading causes of irreversible blindness in our society. What this basically means is that it is very important to detect glaucoma at a very early stage, because nothing can be done to prevent it, but we can certainly reduce the progression of damage and prevent blindness. Glaucoma has also been called silent blindness because it can rob a person of his or her vision without the person not even knowing what is going on. It's only in late stages that obvious problems to the eyesight are noticed by the patient. Now, glaucoma damages the optic nerve in a particular pattern which makes the visual field, which is the peripheral vision, the vision of the side, become less over time. Unfortunately, this is not noticed by a lot of people. Okay, there are certain risk factors for glaucoma. Patients who have a high chance of getting glaucoma include people who have a family history of glaucoma. Okay, there's a predisposition. If your father, your mother, or your brother has got glaucoma, there's a good chance that you might be having glaucoma as well. Now, people who have diabetes, or people who are very short-sighted, or even people who are very hyperopic can have glaucoma. They have an increased incidence at least. Alright. Now again, certain medications which contain steroids can actually accelerate the progression of glaucoma. Okay. So, now, what is important is that everybody goes for eye screening. Now there is a table to actually talk about the frequency on the accompanying PowerPoint presentation that my colleague has put on this website. Okay, which talks about the frequency. Now, what exactly happens is that when you see your local eye care provider, the local eye care provider will examine your eye carefully to look for signs of glaucoma, which can include increased eye pressure. We're also going to examine to see how the nerve looks using certain instruments to visualize the appearance of the optic nerve. And there are other tests which we can do, which include an automated visual field test, and this would be a good indicator first and foremost in diagnosing the problem, as well as to see the severity of the disease if it has already occurred. Now, there is no cure for glaucoma, but glaucoma can be treated, and we usually start treatment with eye drops. And in severe cases, we might actually have to opt for surgery. We might actually suggest surgery, but usually in these days, we tend to start with eye drops first, and there are many different eye drops that we can use to control the disease. Unfortunately, I would like the take-home message to be that glaucoma has no cure, but it is a disease which we do not have to fear if we can identify the disease early and take the necessary steps to prevent worsening of the vision caused by this disease. Thank you very much.